Chapichilinga. I'm a physician, a pediatric infectious diseases physician. I am the director for the pediatric clerkship for medical students, and also I am the medical director for antimicrobial stewardship committee for our pediatric hospital. I'm also an HIV specialist, and I will be your moderator today. The National Hispanic Medical Association is hosting this webinar in recognition of National Youth HIV/AIDS Awareness Day to emphasize the growing impact of the HIV epidemic on our young populations, especially as HIV rates continue to rise alongside other STIs, sexually transmitted infections, and it's more critical than ever to emphasize and ensure that the young population receive access to the care and resources needed for healthy futures. Next. So some housekeeping notes. All the participant microphones are going to be muted. We'll start with introductions and opening remarks, followed by speaker presentations. If you have any questions, please submit them in the Q&A box, and then we will have time for discussion after we finish the presentations. This webinar is being recorded, and all registrants will receive a link to the recording afterwards. And you can also find this on the website nhmamd.org on also our YouTube channel. Okay, with that, let's get started. Next, thank you. The National Hispanic Medical Association was founded in 1994 in Washington, D.C., and it represents 50,000 licensed Hispanic physicians across the U.S. As a national leader in improving Hispanic health, this organization empowers physicians to address health disparities in collaboration with medical societies, medical students, and key partners. Through advocacy and education and partnerships, and NHMA works to create healthier communities for everyone. This association will share clinical tools and resources with all of you at the end of this webinar. Next. Well, with that, I'm just gonna briefly talk just a little bit about myself. I am originally from Peru. This is where I attended medical school. I came to the US to do PITS residency training and also infectious diseases training. And I was very lucky to be able to do have one additional year of HIV training. My passion for infectious diseases came with HIV. I am an HIV specialist since 2021. My focus and my passion is public health with an emphasis on primary prevention among our young populations. With that, let's start with the panel discussion. So Luis Ortiz Fonseca is the director of the LGBTQ Health and Rights and Advocates for Youth, and Manuel Diaz Ramirez is the director of the Community Health Action at La Clínica del Pueblo in Washington, D.C. Next. Okay. Luis Ortiz Fonseca?
Yes. Not very often people say their last name correctly, even though I think it's spelled phonetically. I get Francesca, so I appreciate every time that someone says it correctly. Not that it riles me up, but yes. Happy Naiad. So I take it the floor is mine. It wasn't in the budget to get glitter and fireworks. Okay, it's a tough year. Hey everyone, I'm Luis Ortiz Fonseca, he, they, and happy Naiad. Today is National Youth HIV/AIDS Awareness Day. It is a day where everyone across the country comes together to elevate the voices of young people that are impacted by HIV, but also all of the great work and mobilization and organizing that young people are doing and the adult allies who are supporting that effort. Are the slides up or Am I not just seeing them?
We can see them. I think that you have to say, can we move my slides?
I mean, Zoom be changing so many times in 1 week. All right, so next slide. All right, so Advocates for Youth has been around for over 40 years. Some people may have heard of us. We're primarily known for our reproductive work, but we do that while that is part of our work, that is kind of the umbrella of our work, because we know that underneath that umbrella includes health and rights and LGBT health and rights. And within that is HIV and AIDS. Advocates for Youth works alongside thousands of young people throughout the United States and around the globe as we fight for sexual health rights and justice. And the three R's are kind of like what underpins our organization's philosophy, right? Right, respect, and responsibility. Rights because young people have the inalienable right to honest and inclusive sex ed that is not fear-based, that is universal, but also affirming. And that includes the economic and political and social powers that supports bodily autonomy, self-determination, and self-agency, right? We believe that young people just have that innate right. Respect, because young people are due respect. What young people bring to the table is invaluable. They are leading the fight for equality and justice, and they must be involved meaningfully in all of our work, from the design to the implementation to the evaluation. And that includes policies and programs. Everything that Advocates puts out that is outward face forward, that faces the public, it always is done in partnership with young people and are reviewed by young people. And then lastly, responsibility, because we believe that society has the right and the responsibility to examine and dismantle the systems that create challenges and block access for sexual health services, accessible health care, prevention, and treatment for all young people. And society has the right to challenge the disparities that prevent young people from accessing their full bodily autonomy. Next slide, please. Can you tell me which slide is on the screen? Because for some reason I cannot see the slides.
This slide has CDC reports that nearly
Great.
half of young.
Thank you, because I'll keep talking. All right, so just wanted to include some slides on here that some people may be aware of. Oh, also, before I move on, I have to shout out ECHO, Engaging Communities Around HIV Organizing, which is one of the cohorts that I work to support at Advocates for Youth, because in addition to all of the great work that Advocates for Youth does in partnership with all of our partner organizations, we work with about 8 youth cohorts that we work with from September to May to do work in the communities at the local, state, and national level. And ECHO holds a dear um, part of my heart as a person living with HIV. ECHO is a collective of young people living with HIV who do work at the local, state, and national level to interrupt HIV stigma, but also to amplify and raise awareness about HIV decriminalization. And I have been working effortlessly to pass the decrim federal law so that people living with HIV are not discriminated or face unfair sentences just because they're living with HIV. Over 33 states in this country have HIV criminalization laws, which means people living with HIV can be criminalized simply because they live with HIV. And a lot of these laws and policies are not even scientifically based. And I'll let y'all do with that, with what y'all will, with the current landscape of the world. All right, so CDC reports that nearly half of young people living with HIV are unaware of their status, and that this is, and while this can be scary and jarring and can communicate a fallacy that young people do not care about their health. Young people do care about their health. The work that ECHO and Advocates for Youth and a lot of our partners are doing to address and to basically address this problem is to make testing accessible, right? There are many people who are throughout this country who are living in counties who the nearest health center is an hour away. That is not accessible, right? So when we read that young people, nearly half of young people are unaware of the HIV status, it is not because they do not care about their health. It is because there are challenges and barriers in the way of accessing to accessing treatment, but most importantly, HIV testing. And that's a great segue. You know, a lot of the services in the United States do not meet the needs of at-risk adolescents and young people. We have a great toolkit that we developed with medical providers to provide support for both organizations and medical providers who are supporting young people living with HIV, but also young people who are seeking prevention services around HIV. That means maybe spending a little bit more time with the young person as opposed to spending 5 minutes with them and then going on to the next patient. Asking intentional conversations that are not heterosexist, that do not assume someone's sexual orientation, but that are broad, like how many partners have you had? What do you know about HIV? What do you know about HIV testing? What is it that you want to achieve with this doctor's visit, and or what are your personal health goals for the next year, and how can I be a partner as a provider, as a doctor, as a nurse, as a counselor, as an HIV tester in that, and supporting you to meet that by the end of the year. Those are just some examples. And then in many cases, as I mentioned, young people do not have access to PrEP, period, right? And then many states do not allow PrEP to be prescribed or made accessible to young people without parental or guardian consent. Next slide, please. And this is why ECHO came up with our HIV plan. We know that even now services are being defunded. Research around HIV in young people has been discontinued. And despite all of the great progress we have made in the last 4 decades, we still have a long way to go. We are now closer to a cure than we have ever been. So young people, particularly those at ECHO, are tired of adults in power to make the best decision or the right decision, or leading the fight completely, or designing plans that do not include their voices. So ECHO have come up with these 4 demands that they call our HIV plan. And next slide, please. So the first one is the right to inclusive and honest education. Young people have the right to inclusive and honest education to make informed decisions about their bodies, about their lives, and all things that impact them. Young people deserve sex ed that reflects their realities. This includes realities of Black, Latina, disabled, and queer and trans youth, and education that provides tools, not fear, to protect their health, that talks about pleasure, and that is futuristic, and that is based on their futures, not what will happen if they make a quote unquote bad decisions, right? This is about like how to support young people to envision what their lives would be like and could be like if they received all of the support, and how we can play an integral part of that. We are hopes-based, not fear-based. The second one is the right to accessible HIV prevention. Young people deserve the right to access to condoms without question. Young people should not have to explain how many condoms they need or what they're going to do with the condoms. They should be able to just access condoms. Young people deserve access to HIV testing that is accessible, that meets their schedules. Young people are in school all day. especially those who are in high school. And if testing services are only from 9 to 5, then we are missing an opportunity to support young people. And that continues to be a barrier for young people to access HIV testing. Young people deserve medication and prevention medication like PrEP and PEP without judgment, and that is affordable, and that is without barriers. And all of these services should be provided with the guarantee of confidential, and that what is shared with the provider would not be shared with anyone else, and it should be rooted in care and not stigma. The third one of echoes our HIV plan is the right to quality and accessible treatment and care, right? Young people deserve, period, accessible treatment and care after being diagnosed with HIV. This includes support around housing, around food, around support that is both emotional and physical, but also that includes mental health support. They deserve investment in their futures, and all HIV treatment and care should be centered and around their lives and should be done in partnership with young people. This means asking the young person, are you interested in injectable treatment? Are you interested in knowing about more information about other treatment options as opposed to just prescribing or telling a young person what they should do? The best and most effective forms of treatment are done in partnership with the young person and the medical provider. And the last one is that all young people deserve freedom from HIV stigma and criminalization. Young people living with HIV deserve to live free and fulfilling lives without the fear that they will be criminalized simply because they are young people living with HIV. Lost target people living with HIV are rooted in ignorance, fear, anti-Blackness, and they continue to uphold stigma. And we demand the end of HIV criminalization and shift towards a strategy that is based in community care, access, and education. And we believe that all these four things will help to end the epidemic. And the last thing I would say about criminalization is that we also must examine how that shows up in our personal lives with the conversations that we have, some of the core beliefs that we have about HIV, and what we allow people in our social networks to continue to say about people with HIV, living with HIV, without challenging them and providing more information that can shift their paradigms, provide them education and knowledge so that they do not continue to amplify stigma and further criminalize people living with HIV in their communities. And great segue. Next slide, please. And you'll get to hear all of the young people, at least two of the young people who helped create this. Mars of Echo and Ramirez, along with Antoinette, who is part of the Positive Women's Network, but also a former Echo youth activist, and on a panel moderated by my partner in crime and the person I work with, Armante Butler, tonight at 5 o'clock. And I'm going to drop our toolkit into the chat. And it has the registration link in there. The toolkit has 4 tabs. I'm still learning Google tabs. So if you check out the toolkit, it has content that you can share, information about our HIV plan. And on the 3rd tab are the events that we are hosting this week, which includes the panel that I just mentioned that I hope that you join us later today. And then tomorrow we'll be hosting a screening, a virtual screening with Black Gays Stuck at Home that will be led by a young person from Echo. Next slide, please. Yes, and also in the toolkit on the 4th slide is information about our Youth Activist Network. As I mentioned, we work with young people across multiple issues. We have the Young Women of Color for Reproductive Justice that works with young women and non-binary people who are doing work around reproductive justice. We have the Muslim Youth Leadership Council, student organizers, Youth Resource, which is a collective of LGBTQ young people of color who do work around PrEP access at the local, state, and national level, and then obviously ECHO. So if you know a young person who is interested in applying to be part of our Youth Activist Network, you can find the link in our toolkit. They get a full paid scholarship to come to DC for 5 days in September to receive training around organizing and mobilizing. They'll get to, do this work with over 100 young people who are doing this work across the country, and they get paid $600 in the fall and then $600 in the spring, with a total of $1,200. So please, if you know any young person, any young people who may be interested, and this is for young people who have already been doing the work, but also maybe young people who are interested in getting involved in the work. So please share widely. Next slide, please. And then, of course, as I mentioned, today is National Youth HIV/AIDS Awareness Day. You can follow Advocates for Youth on LinkedIn and Instagram to check out all of the great content that the youth have helped to create. We have highlights and spotlights of our NIAID ambassadors, which are up to 60 young people who are doing hosting events today across community and campuses and HBCUs. And then you can also follow and share widely. And then, if you have any more information or you that you want to share with us that you think that we can share out to our networks, we welcome that. And then if there are any additional questions around what I've shared, or if you want to reach out to me, that is my email. And hopefully I am not over time, and I will pass it back to Patricia.
Thank you so much, Louis, and thank you for sharing this toolkit with us. So now we will hear from Manuel Diaz Ramirez.
Thank you, Patricia. Next, please. So I will try to share a little bit our experience as La Clínica del Pueblo on implementing HIV prevention efforts among Hispanic Latino youth in the Washington, D.C. metropolitan area. Next, please. So addressing HIV and Latinos, in particular with youth, intersects health equity efforts. Next, please. So a couple of details about the communities that we serve. The communities, the Latino communities in this area are around 900,000 people living in between DC, Maryland, and Virginia. 53% of them are foreign-born, recent immigrants, mostly from El Salvador, Honduras, and Guatemala. And recent waves of immigrants are coming from Venezuela and Cuba as well. Also, the first wave of immigrants are back from the 80s when civil wars happened, but also of following years due to natural disasters and also other social drivers like street violence, poverty, and climate change as well. Next, please. So about the current climate and what are our patients reporting, they are sharing with us an increase of sense of fear for deportation, also an increase of preference about receiving services in a telehealth format. After the pandemic, we had a intentional effort to bring them back and to facilitate their access to in-person services as is their preference. However, this current climate that we are living here in Washington, D.C. We have seen an increase of requests for digital information or telehealth format services. Also, we are seeing an increase of stress and mental health in our patients, and also an increase of awareness or understanding that members of the social networks or the communities are started to self-deport themselves. And internally, something that we have started to implement is an enhanced effort on our Know Your Rights education for patients, participants, and staff members as well. Next. As we see in other racial and ethnic minority populations, Hispanic and Latino communities have been disproportionately affected by the HIV epidemic. We can mention a few facts that, for example, between 2001 and 2004, Hispanic Latinos have accounted for 20% of HIV cases, 3.3 times higher than rates for white communities. Between 2010 and 2020, we have seen while HIV diagnosis decreased by 12% overall, Hispanic and Latinos have seen a 24% increase. Also, Hispanics, Latinos represent only 19% of the US population, but we account for 31% of HIV diagnosis and for 26% of people living with HIV compared to their population size, our population size. Among Hispanic and Latinos, in general, but youth and gay and bisexual men have been the ones being disproportionately impacted by HIV. And among all gay and bisexual teens and young adults diagnosed with HIV in 2022, 32% were Hispanic and Latinos, or self-identified as Hispanic Latinos. Also, it's a fact that social determinants are contributing to these outcomes, include particularly poverty, limited access to healthcare and insurance, lower awareness of HIV status, stigma, gender-based social norms, and language and cultural barriers in healthcare settings. Next. Latino communities face several layers of barriers that prevent them to access the healthcare they need. We can mention a few of those barriers. For example, we see variations in access based on immigration status. We have seen that Latinos represent 63.7% of all those without any form of health insurance coverage here in the DC area, particularly in Prince George's County, Maryland. Also, we have seen restrictions on Medicaid access, the 5-year bar. Also, temporary protection status, or TPS holders, are not eligible for Medicaid. Another barrier that we're facing is that only DC offers coverage to adults who are excluded from Medicaid. And low wages create increased barriers to accessing employer-sponsored care. Next. We understand and we consider that one of the key determinants of health for our communities are the possibility to adjust their immigration status. However, we've seen that restrictive federal and state eligibility policies that disproportionately exclude immigrants with varying statuses from safety net services, including health insurance and no workplace protections, the majority being Hispanic and Latino immigrants. Also, financial constraints, as many Hispanic Latinos work in low-wage jobs without employer-sponsored insurance or must prioritize other basic needs. And also, routine experience of discrimination when interacting with healthcare systems, language and eligibility in specific. Next, please. So, on this context, what is La Clínica doing, who we are, and why we are doing what we are doing in our communities? Next. Briefly, healthcare advocates funded La Clínica del Pueblo more than 40 years ago in response to the emerging health needs of displaced migrants, mostly from El Salvador, due to civil war and state-sponsored violence and repression back then. For many of these immigrants, accessing healthcare services in the United States was nearly impossible due to the cultural, linguistic, and economic barriers they face. And this is why La Clínica del Pueblo exists today. Next. We like to see ourselves as a community of care, as a response to an integrated approach of the services that we provide the communities. We have a comprehensive scope of services from primary care as federally qualified health center through mental health, community health programming or prevention and health promotion initiatives to health equity and linguistic access services. Next. So who do we serve directly? We annually serve more than 5,000 people through direct services and 5,000 people through community outreach. 91% of our patients self-identify as Latinos or Hispanics. 80% of them are immigrants. 35% of them are uninsured. 84% have an income that are or below 200% of the federal poverty line. And since we have two sites, one in DC and Maryland, we don't have sites in Virginia. 55% of our patients live in DC. 45% of them come from Maryland or are Maryland residents. Next. So these are the 4 locations that we have: 2 clinical sites, 1 school-based programming, and our community action center in DC as well. Next. So what is our approach for Latino communities, including young Latinos? Next. So because it worked, we implement community engagement with intentionality, meaning we listen, we connect, we support, and we promote transformation of the systems that impact our community's health. We approach our services under the principle of no one left behind, meaning we are implementing efforts enhancing access to services, including medication. Also, we implement an intersectionality perspective, meaning we understand that access to healthcare intersects gender, race, ethnicity, class, and traditional social norms. We also work on an increased understanding the most relevant needs of the communities being served. We are constantly monitoring our patients' needs and our community needs regarding their access to healthcare services. We implement peer-based strategies to build trust from staffing and also to include community health workers. We implement a health literacy approach to health communication efforts to assure that our patients and community members understand the messages that they need to understand to take action on their own health. We implement retention strategies. Many times these retention strategies are not fully funded. However, they are key for patient retention in their care plans. And we do retention strategy. We implement retention strategies such as safe spaces, navigation to essential support services. Also, we embrace technology, understanding also the gaps to access this technology. So digital literacy is important for our model of care. And those barriers and potentials are being addressed. We implement telemedicine technology, we use virtual platforms, and also we have a social media presence. Also, it's important to maintain quality of services in the virtual world. So HIV self-testing, for example, services that we are implementing, mostly since the pandemic, we do not only disseminate HIV test kits, but we do HIV self-testing with virtual peer support in real time. And also, we implement a data-driven approach for all our services that feed into our program designing, including receiving input from the communities we serve. Next. So what we can conclude next. So we can conclude, based on our model of care, that it's possible to promote HIV health among Hispanic Latino youth if we meet communities where they are. We don't wait for them to come to our facilities, but we go intentionally looking for where they are. If we promote trust, healing, and action, if they see, if they are able to see themselves in our staff, if they are given an opportunity to reflect on their own journey, on their process of accessing healthcare, and also having a chance to experience healing on some of those stories and that journey, and also being able to receive support to take action. Also, it's possible if we foster dialogue opportunities to address sexuality and HIV-related stigma. It's not easy for our communities to freely talk about sex and about sex practices, and also it's not easy to talk about HIV among them because of the stigma prevalent in our communities. Also, it's possible if we address communities' HIV health literacy needs with the right information they need at the right literacy level, if we integrate peer community health workers as a key strategy to address health literacy needs in our communities for HIV, if we train youth as health promoters or community health workers, also if we aim to be a safe space ourselves. And we believe at La Clínica del Pueblo that safe space are not only our facilities. Each one of us should be a safe space for our community members, particularly youth Latinos in our communities. And it's possible to promote HIV among these populations if we implement a health equity perspective when planning initiatives and allocating resources. With that, I'll pass it back to Patricia.
Thank you so much, Manuel. So now we have time for questions. Does anybody have any questions, concerns, opinions? I didn't see any on the Q&A. I don't know if somebody else has seen anyone. I haven't. But I can start. So Louis, you gave us a lot of really good information about your organization, and you highlighted the intersections of, HIV with the LGBTQ community, and also racial and ethnic disparities. So what do you think, and this is something that I also, would love to, get from your perspective, what are the steps for healthcare providers and everybody who advocates for, to address these intersections in the care of young people, especially young people that are at risk for getting HIV, or those who are living with HIV?
Are you asking to me, Patricia?
Louis, well,
Louis.
both of you can, you can answer that.
Oh. So I'll go first then. I think it's important to understand how to listen and understand how youth are talking about HIV with their peers. I think it's important to listen to their stories, listen how they are talking to their peers, but also to train their peers, into become resources and tools in their own communities to talk about HIV and address stigma, and what are the barriers for them to have these conversations in their own social environments. And in particular, foster spaces for them to talk about sex in general, and how they understand sexuality, and how we have been raised in talking about these issues, how these topics, how comfortable they feel and what kind of dialogue they are willing to be part of to address their fears regarding, for example, knowing their HIV status, or their concerns about talking to, disclosing with their partners, sex partners, about their HIV status, or knowing their HIV status, or getting tested together, or having those conversations as well, and others that impact HIV, right? How comfortable they may feel discussing with if they are based on the sexual orientation, if they are comfortable with their girlfriends, their boyfriends, and plan together or not those conversations, those decisions.
Yes, in addition to what Manuel said, I would, a lot of us get into this work based upon our own experiences as people of color, as Latino, Latinx, Latina folks, right? Because we grow up as caregivers as well, either by translating, be the translator at our aunt or mothers or other family members' doctor's appointments. And also some of us have experienced loss around AIDS. So I would invite people to examine how that shows up in your life, right? Because there's some adults who will probably say, I grew up as a queer young person and always had affirming adults who would always, when they found out I was gay, say, be careful out there because you don't want to die. Right. Some people may hear that as stigma, as fear-based, but I knew that in their own way, they were telling me that they wanted me to live. Right. So I would, invite people to provide grace, right? And to ask people like if you want clarity around what someone has said that may land on you, what was the intention? But also at the same time, I invite people to examine how they communicate their care or their support, right? We're all growing and we're all trying to figure this out. And we are now in another state of urgency, right? So it can sometimes feel like, get out of the damn fire, when sometimes the person may want to hear, how can I support you from getting out of this burning house? Right. So neither one is right or wrong, but assessing like which would is best for the person we're supporting, but also if what are the other ways that we can learn to communicate that. And I'm going to drop in our medical mentorship toolkit that was created in partnership with young people. And as I mentioned, it's for doctors and also organizations who are working with young people living with HIV who are in the space of transitioning. Right. So if you are working with a young person who's 23 and maybe they're transitioning to adult care, this toolkit will support you on how to prepare them. And then if you are a doctor or a medical provider who's being referred to someone who's now, navigating adult care, which is very different from supporting young people, because as a young person, I would get calls as reminders for my appointment. I was asked if I needed an escort or if I needed transportation. Now as an adult, it's like, child, you missed your appointment. Here's a $25 fee, right? So like, again, this toolkit is for young, for doctors who are also inheriting, quote unquote, young people who are navigating adult care for the first time. And then the last toolkit I'll share is the Building Cultural Responsiveness Toolkit. And a lot of what Manuel shared is included in that. And it's a toolkit that you can do on your own because doing the internal work is never easy, but it's necessary. And as a person who does this work, I'm doing that every day.
Patricia, if I may add, also listening to Louis, what Louis was saying, made me think that something that we talk here at La Clinica when addressing health literacy among our patients, including youth, is that we understood that the responsibility shouldn't be put all over our patients, including our youth, right? So we as organizations have a responsibility, a role to play in ensuring those conversations among the communities we serve, but also it's our responsibility to create the systems and the structure and the workflows that promote trust among our communities. So training ourselves, educating ourselves as providers is key to implement the right initiatives, the right services that will resonate among our patients, our participants, but also among youth in specific, right? So it's our role first to ensure that we do everything that is possible for them to feel confident and asking their provider, asking their educator, asking their the health educator, asking their nurses or medical assistant or intern worker feel confident and confident enough to having those conversations, right? So our staff many times report not feeling very comfortable asking certain questions, like when was your last time that you got HIV test result? Why are your sex practices, right? The circumstances of the concern that you have, that you think that you were exposed to HIV. So we have to train staff. We have to give our staff the tools that they need and the information that they need to be able to provide that kind of services that will promote trust among our patients and participants, but in particular among youth.
Yes, I will just have to add, thank you so much for this toolkit. I think I'm going to share with my colleagues because I think it's very important, especially here where I am located in the South. And I would like to say that I think everybody, not only, physicians, but everybody who interacts with patients or clients, I think we should receive some implicit bias training, and that's something that I did during my HIV fellowship, and it was really enlightening, right? Like you can tell, even me as a Hispanic, physician and everything, you should be going into that no matter what, no matter your background or ethnicity. I think is very important because we also need to internalize, okay, and say, this is what how I was raised. But here, I am here right now at my age, after all my training, after everything that I have, encountered with patients, with teenagers who are, sometimes they are even scared to talk to me when I'm really like, open, and I'm like, you shouldn't be afraid of talking to me because I'm your provider. Everything is between you and me. And, I'm the person that it has to know stuff so that I can help you, right? But I think the more that we try to, be aware and cognizant about that, the best outcomes from our interactions with our patients and even preventive efforts. Okay, so there was a question for Louis. Is there any age restriction for the program or the fellowship that you mentioned?
Yes, it's 14 to 24. And we are prioritizing, if anybody is 14 to 24, and again, it can be someone who's a seasoned organizer, but also someone who may have expressed interest in, stepping into some organizing work or learning about organizing. And we're prioritizing, of course, people from the South.
Does anybody have any other questions? Well, I think that something that I emphasize initially that I was looking for, it's primary prevention, right? Like also try to focus on talking with young people about the risks, and be open to talk about sexual health. Something that I find is that people everywhere, not only in conservative places, but I think everywhere, people and providers and even peers have this idea that we shouldn't be talking about that. And something that I found that is also very important is that we should focus, as your slides are showing, we should focus everyone. Like not only, MSM, we should all focus females that are heterosexual. Like something that I have done during the past months, it's advocating for, the promotion of preventive treatments, including PrEP, among women. because here in the South, we have so many babies that are exposed to maternal HIV, and it's just heartbreaking to me that we have the idea that prevention is only for just a small population, and that's not true. Do you have any input on that, or anything that you can share with us?
Oh, I didn't want to talk again. Um, can you repeat the base question? I'm sorry.
Well, what I try to say is that the primary prevention, right? Prevention shouldn't be just for just a group of people or MSM only, or you know what I'm saying? Like even when I have been in panels talking about how they promote prevention, promote PrEP, you know, the misconception that it's only for MSM, or that, as you were saying, right, being MSM is gonna give you HIV. I think that we should be trying to be inclusive with everybody who could be at risk of getting HIV. So how do you approach that in your communities? Like meaning involving also heterosexual individuals, including women, because I feel that some of them are neglected when we have efforts to prevent HIV?
Great question. And we have a cohort called Community, which is a collective of young Black women who are doing work in their communities around amplifying the impact of that HIV and AIDS has on young Black women across the identity spectrum. Right. And I just dropped the link in there so you can check out the cohort, this year's cohort. Um, and yes, part of the work is, ECHO includes, young women who are heterosexual identified and young people who, were born with HIV, right? I think that sometimes that population is sometimes forgotten about in 2025. But I think that, a lot of our work and the collective work that we need to continue to do is to think of HIV as expansive, right? That includes age and young people. While, because I've been to spaces and there are conferences that still do not include young people. And while that may be a trip for us because we may be aware or intentional or invest in young people, even some spaces their lens of HIV is not expansive enough to include young people. And if it's not including young people, then we know it's not including young women. It's not including people who are interested or want to become parents and give birth. Right? We know that if we are not talking about HIV in reproductive spaces or connecting it to other healthcare experiences, that we're missing a lot. So Community, check out Community. They have tons of great videos on My Story Out Loud. It is not part of the Youth Activist Network because the people who are in Community are part of the Youth Activist Network. So you can be part of Community if you apply for the Youth Activist Network. I know that's confusing. Trust me, I work at Advocates, and we're always still trying to figure that out. But again, if young Black women who want to be part of Community also get paid $1,200 a year, and they organize Women and Girls HIV/AIDS Awareness Day Week of Action, and their year starts January to December. And again, anybody who wants more information, feel free to reach out to me. Thank you, Patricia, for raising that, because that was why Community was ultimately created, so that the fallacy that that only queer, gay young men deserve to be invested in, and they do, but also other parts of our community, because because even young gay men have best friends who are young Black women, right? And HIV care and HIV treatment and HIV support includes supporting the universe of all people impacted with HIV. So thank you for bringing that up.
Any other questions or comments? I guess, Manuel, do you have something to add?
No, not really. I think Louis summarized it perfectly. The key is integration and universal approach. I agree with him in this. It's important to see how our community is interconnected. And we have to, from prevention efforts, community engagement, and outreach efforts have to be with a universal perspective. The whole community needs to be aware of these topics to address stigma, but also internally in our programs, we have to integrate, right? So our mental health team co-participates in efforts for HIV prevention, and also our gender-based violence prevention team also addresses HIV prevention because there is an intersection of them on those topics, how gender-based violence, the way, for example, we men are raised in our communities, has an impact on how we address HIV for ourselves, with our partners, our sex partners in our community. So it's important to have a very comprehensive approach to HIV.
Yes, thank you so much. And I think the final message is that we all should be like a safe space for our young patients or young peers. So I will wrap up with all the questions. And if you have any other questions, you are welcome to email us. Thank you so much. And this is an upcoming event. Here you have the QR code. Thank you for sharing this with us. If you are, interested in participating and being more involved in advocacy, you can email. And here you have the email for Ashley. And then these are all the social media, accounts where you can continue to be actively, involved in our efforts, and also more training and webinar and, discussion opportunities that we will have. And we appreciate you being here. And you can continue to go to the website for more resources and tips. And thank you so much for your participation. Thank you, Manuel. Thank you, Louis. I think it has been a really amazing opportunity to share with all our participants and all the resources that are going to be super useful for me as well. I think that we never stop learning about prevention and about how do we need to advocate for our young patients for a better life.
Thank you, Patricia, for our.
Yes, thank you for having me.